support. If there's a fellow person, who collapses, who needs some emergency help, and if there are a few things which can make the difference between the death and the life, are these skills, and that is why it is very important. So gone are the days when the physicians were carrying such crude box containing all these equipments, like the syringe, the otoscope, and the other different instruments which you can see. So these instruments cannot be there present everywhere. So that is why we need to learn some of those skills as well. So I've given you a link. Go through this link, and uh, when you will be going through this link in the video, you will be able to see a young kid which is drowning in the water. So there are some brave people who go and rescue them up, the kid. However, the problem what happens is what to do after that. So that is where, as I said it, with these basic skills, you can make the difference between the life and death for a person. So that's why these skills are very important. So things like this and all has been going on since a long, long time. So these are some of those earlier pictures which was there in the 18th century. And with passage of time as well, things has been changing. So similarly, even for this as well. So what has been happening is the first aid is one of the important things I think everywhere in the world, people have to take Hippocrates oath. Hippocrates oath is simple thing is in simple terms. Uh, if you can't help someone, at least don't do any harm. Don't do any harm if you can't help someone. So that is the thing is we should be able to know when to give it, to whom to give it, okay? And that is the reason why a lot of times what happens is, yes, there are a lot of injuries in which it may not be even used, in fact. So that is why actually the first aid is the immediate care which is given to an injured or suddenly ill person. And that's why I was telling you. So I really believe that every common man as well should be able to know, in fact. Okay, and this is the reason before the basic life support or the advanced cardiac life support. First is aid is the minimum thing, in fact. So there are two things which is really important from the legal aspect. One is the expressed consent, so which is the if there is a conscious, mentally competent person of legal age, yes, that person can give. Something is called as implied consent. Implied consent is if there is someone who is an unresponsive, okay, state and having a life-threatening problem. So that means implied consent. So we also have to be thinking, what are the other legal, medical legal considerations? So what happens is the person who is there in the neighborhood as well, they are the ones who can do it. And yes, if someone is, for example, there is a traffic accident and someone is literally going away from there, indeed, this will be something like nothing less than a crime. And yes, when we are traveling to any of the countries as well, we should keep it in mind. A foreigner should obligate to abide by the laws of the country, whichever one is in, actually. So now coming to the basic life support. So it does happen nearly up to zero point 0.7 million cardiac arrests tend to happen in Europe. Okay, so it's a very huge number, and that is the reason why a lot of times what happens is if someone is doing like the early resuscitation and prompt defibrillation, just within 1 to 2 minutes, you can have more than 60% of survival. So this is a chain of survival. So what is this chain? In which you try to early recognize and call for the help. You try to start the early CPR, trying to buy more time, and then do the early defibrillation, and finally try to initiate the post-resuscitation care to restore the quality of life. So you all would have already heard CPR pretty oftenly. So CPR stands for cardiopulmonary resuscitation, which is an emergency first aid procedure used to maintain respiration and blood circulation in a person whose breathing and heartbeats have suddenly stopped. Okay, so as we all are aware, there are three basic vital functions: breathing, circulation, and the consciousness. So, in early days as well, since way back in 1970s, Peter Suffer was from Pittsburgh, is the one who wrote the cardiopulmonary resuscitation. Finally, the guidelines came. They were further modified as well. Various algorithms could get into the place for this. There are these documents available from the European Resuscitation Council, and I would really like you all to go through this. And you can get a lot of those official links, the documents, the guidelines as well. So that's what I'll try to summarize. So the main logic of CPR is based on what is called as thoracic pump theory. So whenever we compress the chest, the blood is going to come out of the thorax because by increasing the intrathoracic pressure, okay, and the time of chest compression and of course the decompression should be equal, okay, and that's the reason it should not be like you're doing 30 compressions and 45 decompressions. No, that doesn't suit well. So this is the reason. So something is called coiling and recoiling. The decompression is a more of a inactive process. So it should completely be released, in fact. And hand should never be off the chest. So what happens, we all are aware, the oxygen content of the atmospheric oxygen air, which we breathe in, is nearly 21%. However, in the alveoli, it goes down to 14%. Similarly, once we exhale that, from the diluted air, so it may be around 16 to 18% oxygen. So that is the reason you're trying to ensure that the victim's hemoglobin is going to be over 80% saturated. Yeah. And so what happens during the cardiac arrest? There are few things which we all should be keeping in our mind. First is the asystole, the ventricular fibrillation. In fact, so a lot of these cardiac arrest victims, they have a abrupt cessation of the function, okay? And a lot of these patients also have the pulseless ventricular tachycardia. So the heart is going to be contracting at a very high heart rate without any significant output. So how to differentiate between the VT and VF? Of course, with the ECG or monitor, you can do it. So what you're trying to do is, with the chest compressions, you're trying to give at least nearly 30% of the normal perfusion, which is going to the heart and the brain. And in the meantime, you're trying to buy some time, okay? And always remember that. So within 3 to 5 minutes or beyond that, whatever the damage is happening, there will be irreversible cerebral damage. So that is why you're trying to buy more time. So, and also reverse if there is any irreversible causes for the arrest, in fact. And that is why what happens is, as soon as there is a cessation of spontaneous circulation, okay, if you are able to do it, however, with passage of every minute, the chances decreases by 10%. So after 10 to 20 minutes, chances are going to be very, very minimum that one may be able to resuscitate. But don't forget, there are cases in which even after 1.5 hours of resuscitation as well, they have been able to revive. So there's no limit for that, but we all are humans. There are some newer tools and machines as well, which has been brought for doing CPR. However, we should know what are the limitations as well for that. So there are slightly different etiologies for the adult, for the cardiac arrest, which is normally ischemic heart disease. However, for the children, most commonly it is suffocation or choking, in fact. VF may happen, but very rarely, and a lot of times trauma, in fact. So, depending upon the etiology, we may have to deal in a different way. So, adults, yes, defibrillator should be electric defibrillator should be applied as soon as possible. Try to alert and call for help and start with the CPR immediately. However, for the children, okay, start the CPR immediately and then call for help. In fact, so the helplines can be different in your different country, and trying to indications. So, what are the different indications? It could be myocardial infarction, malignant arrhythmias, pulmonary embolism, intoxication, electrocution, drowning. The one video which I shared the link. Go back to that video. You can follow the channel as well, the YouTube channel. It's a beautiful channel, contains a lot of cardiology lectures as well. And must watch that video. You know how you can make the difference in the quality of life of people, in fact. Then similarly, stroke or other problems as well. So what I was telling is, a lot of times CPR is not even indicated. When? When is it not indicated? For example, if you're aware that the biological death has already started, and we are aware that it has already been like 15-20 minutes before the rescuer has arrived. Similarly, if someone is having a malignancy, there's terminal stage of incurable disease, it might not be so helpful. Similarly, if someone has had a catastrophic head injury, so it decreases the chance for survival. Similarly, if there are if someone has already expressed a consent, that DNR, do not attempt resuscitation, so then it should not be done. And of course, if someone has been executed, and one of the key things which I really wanted to emphasize was age is not a contraindication for not initiating CPR. So we are aware if someone is having a VF, okay, so that is always a better, it has a better outcome compared to a person with asystole. And so whenever this thing happens, that the timing of defibrillation matters quite a lot. So for example, if within 1 minute you are able to defibrillate, the person has a survival rate of nearly 90%. Similarly, within 5 minutes, survival rate decreases but up to 50%. Then by 7 minutes, up to 30%. So longer is the time for defibrillation, the chances of survival tends to keep coming down. So what happens is, why I was trying to tell as well, CPR should be started as soon as possible, because within the 4 minutes, the brain damage is unlikely. However, within 4 to 6 minutes, brain damage is possible. And 6 to 10 minutes, the brain damage, high chances are there for that. So as we are aware that especially what happens is, especially the cells of the brain cortex are the ones which are very sensitive for the perfusion and oxygenation. And that is why the irreversible damage is going to start to happen within 3 to 5 minutes, in fact. And this is the reason we all should be really careful how to assess a patient, especially for the signs of cardiac arrest. So if someone is unconscious, so within several seconds, of course. Similarly, if someone is having a respiratory arrest, okay, or someone is having the last gasp, or it is called as gaspal breathing. So it is nearly like 1 to 3 minutes of cardiac arrest. However, if sometimes we may be able to see also the pulseless or arteries. So especially when we try to palpate for the carotid or the femoral arteries, we can feel that. Otherwise, when we try to look on someone's color or the face changes, it's completely pale. Others, so yes, that is the other one. However, if we see pupil dilatation, what is called as mydriasis, it is not a reliable sign for this. So the old guidelines, what used to say was the signs of cardiac arrest are unconsciousness, no reactivity, and also loss of normal breathing. However, things have changed. So what happens is, whenever we are trying to think for the CPR, the rescuer's safety is the first priority. Okay, so they should be able to take care for their own safety as well, and to assess the risk of trauma intoxication and also the infection. Try to see for the victim's position. Is it supine to her or on her back, in fact? And always try to use a flat surface. It should not be, foamy bed, which is going to make the compressions less effective, in fact. Similarly, the victim's position for in relationship to the rescuer's position. So the rescuer should be in a comfortable position to be able to do the CPR. And then a lot of times question comes is like, how about CPR during the transfer? That's why I said it. Now there are devices, mechanical devices, which can do that. Okay, and the rescuer can take some rest as well. And yes, one of the key things we all should try to take sure that the rescuer doesn't place himself at a more risky position. So that is why before starting the resuscitation, try to have a look around. Look for ongoing traffic, electrocution, toxic fumes, or poisons as well. It should not be happening that, okay, you see someone in a busy road, someone has fallen down and you start doing CPR over there. No, that's not wise. Try to take that person immediately to a side, a little bit safer position. Otherwise, you yourself will be having the risk of to be run over by the vehicle. Okay, so that is also important, in fact. And then always try to also see for what is called as universal precautions. Universal precautions, try to think for the airborne infections and also the bloodborne infections. So bloodborne infections like hepatitis B, C, or even HIV can be easily transmitted through the blood, solutions, excreta, sweat as well. Sweat chances are very less, like up to 1% as well, but it may happen. Similarly, the airborne infections. So whenever you're trying to think about the tuberculosis bacilli or the herpes or the meningococcal as well, so it can get easily transmitted through the mouth-to-mouth breathing as well. So self-protection is important. So what can you do for that is use personal protective equipments in the form of gloves, barrier protective devices, or the mouth to barrier devices as well. I'm going to show you some examples for that. So because as I was telling you, these are important to take care of oneself, especially from the infection. And as I was telling you, and it is better to use these protection devices. Okay, so this is why the concept of universal precautions has been used, in fact. So barrier devices are quite a lot available, like face shields, pocket face masks, handkerchief as well. Similarly, towel as well is pretty something easily available, which can be sensibly used, in fact. Okay. And okay, once you have initiated the CPR, so when should you stop? So if the victim is already starting to breathe normally, medical assistance has come, okay, and they ask you to stop, then yes, if you're physically exhausted as well, you should. Similarly, if CPR has been done for more than 20 minutes and still there is no restoration of the spontaneous circulation, it should be stopped. However, before that, if you are really feeling physically exhausted, you think you may not be able to help. Otherwise, if there are signs of biological death, like the post-mortal rigidity, the post-mortal cooling, even the gravity-dependent livid states are there as well, you should stop it. So there are different letters which is there for the adult and the cardiac one. So for the basic life support, it goes like ECA. So EKG, circulation, airway, breathing. However, ALS, the advanced life support, is the one which includes the drugs as well. So the main difference between the basic and the advanced is the use of drugs.